So we will be discussing liver today, a very important topic. Liver is the largest gland in the body and second largest organ. It occupies these quadrants. The right hypochondriac, right lumbar, epigastric, and the left hypochondriac also. That's how it forms the anterior relation of the stomach. Stomach anterior relations are three: liver, anterior abdominal wall, and rib cage. Of course, the transverse column comes and forms the gastric triangle. The liver is divided into right and the left lobe by falciform ligament anteriorly. When you look from the posterior aspect, on the posterior aspect of the liver, you see two important structures which are dividing the liver into left and the right lobe. One is ligamentum teres and other is ligamentum venosum. These two are the embryological remnants. Ligamentum teres is the embryological remnant of the left umbilical vein which is getting blood from the placenta. Ligamentum venosum, this is Fisher for ligamentum venosum, is a remnant of ductus venosus. Ductus venosus. Why they are continuous with each other? Because this umbilical vein, the left umbilical vein, which is now here seen as ligamentum teres, is getting fresh blood, oxygenated blood full of nutrients from the placenta. You don't want the liver to consume it so much, because normally all blood goes to liver. Liver processes the blood. Here, your mother, since you were in your mother's womb, has been providing you ready-made food. Now she provides you ready-made food. When you were in the mother's womb, she was providing you ready-made blood full of nutrients. No need for liver to process it. So therefore, if no need for liver to process it, there is this ductus venosus which bypasses it to the inferior vena cava. So for function of ductus venosus was to bypass the blood coming from the placenta, bypass it to the liver and take it to inferior vena cava, because liver is not processing the blood. It may get little blood that is required from the hepatic artery. Like we have the missing link which will be starting, all of you are aware, missing link starting from 1st May. So those travel from Mumbai to Pune. Khandala's Ghat. Now we will be having a missing link which will be directly bypassing Khandala. So this is a missing link. What is the missing link? Ductus venosus, the missing link for the liver. So liver, again I repeat, is divided into right and left lobe by falciform ligament anteriorly, ligamentum teres inferiorly, and ductus venosus posteriorly. आप बोलेंगे inferiorly क्यों है? Because ये ऐसा है posterior और inferior ऐसा जाता है, थोड़ा सा mild, इतना नहीं, slow. Okay? Now we'll be talking, apart from that, a liver has a quadrate lobe, which is part of the right lobe only, caudate lobe, and we'll be discussing the boundaries of this. Okay? Now talking about the peritoneal relations of the liver. Liver is intraperitoneal, covered by peritoneum, except for this is the bare area 1. Now what happens is, this falciform ligament goes here, from here it reflects, here it reflects, from here it reflects on the kidney, from this L-shaped thing it goes to the stomach as lesser omentum. This is called as left triangular ligament, this is called as right triangular ligament. This is the superior layer of coronary ligament, this is inferior layer of coronary ligament. This is bare area number 1. Fossa for gallbladder is bare area number 2. Fissure for ligamentum venosum is bare area number 3, which is not covered by peritoneum. ना देखो यहाँ पे peritoneum है, यहाँ पे नहीं है. Porta hepatis, where there are our 3 structures. Porta hepatis is bare area number 4. Then the coronary ligament over here is bare area number 5. Okay, so 5 to 6 bare areas are there on the liver. What are the bare areas on the liver? Faisal? Bare areas, one large posterior bare area which lies between the superior and inferior layer of coronary. Fossa for gallbladder is bare. Fissure for ligamentum venosum. Porta hepatis, the area between the left triangular ligament. So these are areas not covered by peritoneum, bare areas. So that is the peritoneal relation. Liver is covered by the peritoneum except for 5 bare areas. Now let's go to the visceral relations of the liver. When it comes to the visceral relations of the liver, we divide the liver into 5 surfaces: superior surface, anterior surface, right surface, and then grossly, this is posterior surface and this is inferior surface. Lower down here is inferior surface. Okay? Is it clear? Is it clear? So now let us discuss the relations, and I am going to talk about max 3 to maximum 5 relations on each area. Let us start with the easiest ones. 1. The superior surface is covered by diaphragm. It is related to diaphragm. It is related to the base of the lungs, and it is related to the pericardium and heart. So diaphragm, 3 relations: diaphragm, lungs, pericardium and heart. Diaphragm, lung, pericardium and heart. Anterior relation. Anterior relation. See, here the rib cage will go like this. The rib cage goes like this. Okay? So anterior relation is ribs, right? Then diaphragm and anterior abdominal wall. So बीच का एक छोटा सा पोर्शन है जो anterior abdominal wall, जो exactly यहाँ पे है, between the V, inverted V of the rib cage. Okay? So what is the relation? Huh? Three anterior relation: rib cage, diaphragm and anterior abdominal wall. Now coming to the relation on the right surface. एक तो ऑलरेडी मालूम है आपको, डायफ्रैम. यहाँ पे लंग्स आता है. लंग्स के पहले प्लूरा आता है, सॉरी ये लंग्स निकाला है मैंने. प्लूरा आता है और प्लूरा ऐसा ऊपर चला जाता है. फिर लंग्स आते हैं और वो भी ऊपर चले जाते हैं. Is it clear? So right surface is related to diaphragm in the lower 1/3. Diaphragm in the lower 1/3. In the middle 1/3, diaphragm, lung and pleura. Sorry, diaphragm and pleura. Diaphragm and pleura. In upper 1/3, diaphragm, pleura and lung. Diaphragm, pleura and lung. Pause for me. So the right surface is divided into lower 1/3 related to diaphragm, middle 1/3 related to diaphragm and pleura, and upper 1/3 related to diaphragm, pleura and lung. So what is this? You have studied already in thorax. Costo-diaphragmatic recess. Recess means a gap. Okay? Short recess, long recess. We don't have short recess. Okay? Now long recess also depends on the seminar. कितना सेमिनार है आज? दो. किसके है? एक आपका है और राहुल सर. स्टूडेंट्स है ना? Is this clear? Okay. Now going to the posterior surface. ये थोड़ा सा difficult है समझने में. Posterior surface. On posterior surface, you see one lobe called as caudate lobe. Here is IVC. This IVC goes up then. Okay. It is behind. This is porta hepatis. This is fissure for ligamentum venosus. So caudate lobe is guarded by IVC on one side, fissure for ligamentum venosum on other side, left side, continuous with superior surface and inferiorly porta hepatis. Quadrate lobe is there on the posterior surface. Quadrate lobe, Shreya, quadrate lobe is there on the posterior surface. It is guided by porta hepatis superiorly. Inferior border of the liver is the only border which is prominent and seen. Other surfaces are round, continuous with each other, borders are rounded. IVC and the three hepatic veins connecting it, this is the main support of the liver. Actually आप liver जब anatomical position में classically पहले पकड़ते थे तो ऐसे IVC में से forceps डाल के ऐसे पकड़ते. That is how in the exam people actually are supposed to do. But if IVC is broken, you can hold it in your hand like this. But examiner may ask you, is this a classical way? So classical way is okay. जो पिछले कुछ साल पहले जो हमारे वर्ल्ड में कुछ विकृत वॉरियर्स रहते थे ना, जैसे लोगों को मार के फिर भाले के ऊपर सर रखते थे ना, वैसे लिवर को आईवीसी के ऊपर रखना है. और ऐसे मत करो, ऐसे ही रखना है. ओके. अभी यहाँ पे क्या है देखो, यहाँ पे है इसोफेगस. ओके. फिर स्टमक यहाँ पे है. और यहाँ पे फर्स्ट पार्ट ऑफ डिओडिनम है, फर्स्ट पार्ट ऑफ डिओडिनम क्वाड्रेट लोब में, सेकंड पार्ट ऐसे जाता है, यहाँ पे है किडनी, यहाँ पे पूरा किडनी, यहाँ पे है सुप्रारेनियम, सुप्रारेनियम क्वाड्रेट लोब में है, क्वाड्रेट लोब में है राइट क्रस ऑफ डायफ्राम, क्वाड्रेट लोब में है डिओडिनम, क्वाड्रेट लोब में है डिओडिनम. Okay, come on now, let's list the things related to posterior surface. Esophagus, quadrate lobe with right crus of diaphragm, IVC, and bare area में suprarenal. 1, 2, 3, 4. Okay. Inferior surface, stomach, quadrate lobe में first part of duodenum, gallbladder and kidney. Inferior surface. I'm going to repeat this again for all of you. Okay? Porta hepatis is from where the three structures come down, some come out, some go in. Going in is hepatic artery, going in is portal vein, coming out is bile duct. Okay? Main supports of the liver, a falciform, triangular, right triangular, these are not the main supports of the liver. Main supports of the liver is IVC and the three hepatic veins, the surrounding viscera, okay, surrounding viscera, intra-abdominal pressure. Blood supply of the liver is from both portal vein, यहाँ पर portal vein में बहुत सारे nutrients है but deoxygenate. So main blood supply is from hepatic artery, which is branch of common hepatic artery. Okay. Development of liver, I have told you, it's from the hepatic bud which goes in the septum transversum. It gives cystic bud, septum transversum, and the broken umbilical and vitelline veins. Histology of liver means you need to know three things. What is hepatic lobule? What is portal lobule? What is hepatic acinus? बोल काय मृणाली? Hepatic lobule is the area drained by one central venule or central vein. Area drained by one central vein. Now consider this triangle connecting the three central veins. Here are hepatic triads. So one portal vein will be here. It will be sending blood like this. This is portal lobule. Portal lobule is area supplied by one portal venule. ओके, तो ये ट्रायड, ये कॉर्नर्स पे ट्रायड्स होते हैं. वो ट्रायड में से Now consider this part, जहाँ पे एक hepatic artery ऐसा रन कर रहा है, and this is hepatic acinus, where one artery is supplying this. यहाँ पे भी ना 3 zones होते हैं, zone 1, zone 2, zone 3. तो जब कोई पॉइजन खिलाता है तो लिवर एग्जामिन करते हैं zone 1, zone 2, zone 3. zone 3 में पॉइजन पहुंचा है मतलब सीवियर पॉइजनिंग. Similarly, malnourishment also we check like this, whether zone 1 का ग्लाइकोजन डिप्लीशन है, zone 2 का ग्लाइकोजन डिप्लीशन है, या zone 3 का ग्लाइकोजन डिप्लीशन. ओके, एप्लाइड एनाटॉमी ऑफ लिवर. कंजेनिटल एनोमलीज बहुत कम होते हैं. एक एडिशनल लोब, अजाइगस लोब करके होता है लिवर को, कभी कभी आईवीसी के बिहाइंड जाता है. Investigations of the liver, SGOT, SGPT are the indicators. Hepatitis is medical problems. Amoebic liver abscess, which may be needed to be drained surgically, and cancer of liver. Main is cirrhosis of liver, medical में. Hepatitis B, alcoholism, fatty liver. Nowadays in India, because of the junk food, fatty liver, every alternate person has fatty liver nowadays. So much, so common. I'm little exaggerating, every alternate person, but in elders, most of them have fatty liver grade 1. Okay. हाँ? Surgical मध्ये amoebic liver abscess. See, because portal vein is draining the IVC, draining the small intestine. वहाँ कुछ amoebic infection हुआ तो sometimes the amoeba is very easy for it to go to liver. So amoebic liver abscess is very common. So we are discussing the liver. The liver occupies the 4 quadrants: the right lumbar, right hypochondriac, epigastric, and left hypochondriac. Sorry, problem झाला. So we are discussing the anatomy of liver. The liver is the largest gland, second largest organ. It occupies 4 quadrants: the right hypochondriac, right lumbar, epigastric, and left hypochondriac. It is divided into 2 lobes, right and left lobe, by the falciform ligament anteriorly, by the fissurefur ligamentum venosum posteriorly, and ligamentum teres inferiorly. Then we come to the relations of the liver. And then the peritoneal relations. Liver is completely covered by peritoneum anteriorly. On the posterior aspects, there are few bare areas. One bare area is between the right and the left triangular, the right and the left superior and inferior layer of coronary ligament. One is at the fossa of gallbladder. One is at fissure for ligamentum venosum, porta hepatis, and at the left triangular ligament. So these are the bare areas of the liver. Now coming to the relations of the liver. Anterior relations are 3: ribs and diaphragm, anterior abdominal wall. Superior relations are 3: diaphragm, lungs, pericardium, and heart. Right surface of the liver has 3 relations: diaphragm in lower 1/3, in middle 1/3 diaphragm and pleura, where the costodiaphragmatic recess is there. In upper 1/3 diaphragm, pleura, and lung. Posterior relations of the liver are esophagus, quadrate lobe, where there is the right crus of diaphragm, IVC, and suprarenal in the bare area. Then there is, in the inferior surface, there is stomach, first part of the duodenum in the quadrate lobe, then the gallbladder, and kidney. The support of the liver is mainly the IVC and the 3 hepatic veins, surrounding viscera, and the intra-abdominal pressure. Development of the liver is from the hepatic bud, which goes into the septum transversum and breaks and forms hepatocytes. Septum transversum forms the Gleason's capsule and the fibrous network, Broken umbilical veins also contribute to the sinusoid formation, and Kupffer cells come from the mesoderm. The histology of liver is also asked for 2 marks. The histology of the liver, 3 things are important. One, what is the hepatic lobule? That's the area drained by one central vein. What is a portal lobule? That's the area supplied by one portal venule. What is hepatic acinus? That is area supplied by one hepatic arteriole. Okay. Applied anatomy of the liver, their investigations, SGOT, SGPT, medical problems, mainly to hepatitis, and second is cirrhosis of liver, which leads to ascites and portal hypertension, surgical amoebic liver abscess, and last is liver cancer. Thank you. कितने मिनट झाले?
2 minutes 54 seconds.
54 seconds. What a precision. Thank you. Ubaid sir, जरा सा. So the next topic is portal vein. Portal vein, all of us know that it is formed behind the neck of the pancreas. Formed behind the neck of the pancreas. Formed behind the neck of the pancreas by union of splenic vein and superior mesenteric vein. And then it goes behind the first part of duodenum. Behind the first part of duodenum. So it has first part which is infraduodenal, second part which is retroduodenal, and third part which is supraduodenal. Okay. Now I am drawing the portal vein here separately. Portal vein here separately. This is the portal vein formation. There it goes again and divides into right and left branch. With branches. ऐसा बहुत rarely होता है. एक retromandibular vein था. So this also branches, okay. In the right branch, a cystic vein drains. In the left branch, para-umbilical veins drain. Para-umbilical veins, they drain. Okay. In the portal vein itself, drains the left gastric vein, the right gastric vein, then superior pancreatico-duodenal vein. Superior pancreatico-duodenal vein. So these are the tributaries. Okay, 3: left gastric vein, right gastric vein, superior pancreatico-duodenal vein, draining directly into the trunk of the portal vein, cystic vein draining into its right branch, para-umbilical veins draining into its left branch. Now the relations. अभी यहाँ पे ना मैंने थोड़ा सा ये बड़ा निकाला था अपना डिओडेनम. ओके. Relations. First part, second part, third part, anterior, posterior. Somehow आपके टेक्स्ट बुक में आजकल कुछ अलग दिया है, बट आई एम नॉट स्टिकिंग टू व्हाट इज देयर इन माय टेक्स्ट बुक्स. हमने, अगर आपको याद है, जब हेड ऑफ पैंक्रियास स्टडी किया था तो हमने बोला था यहाँ पे पोस्टीरियर रिलेशन इज IBC. So that also remains the posterior relation for the portal vein, IBC. Now पोर्टल वेन, यहाँ पे मैंने चिंटू दिखाया था, अभी मैं उसको थोड़ा सा बड़ा करता हूँ. वो पोर्टल वेन का एंटीरियर रिलेशन, सी द common hepatic artery, it will come like this, hepatic artery goes like this, gastroduodenal comes here. So we are talking about infraduodenal, retroduodenal and supraduodenal. Abhi retroduodenal, the names gives you one relation. What is the anterior relation? Anterior relation will be duodenal. Infraduodenal, anterior relation will be pancreas. बरोबर की नहीं? Infraduodenal anterior relation will be pancreas. Supraduodenal anterior relation will be liver. Because वो ऑलमोस्ट पहुंच रहा है वहां पे. तुम्हारी बाजू की लड़की तो फुल फाइट मार रही है. रात भर पढ़ाई क्या क्या वो ऐसा 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 हो रहा है. But these are not the main relations anteriorly. Anteriorly, the main relation is common bile duct. Alright, bile duct, common bile duct, and gastroduodenal artery. Gastroduodenal artery. In upper part there may be hepatic artery. Upper part there may be hepatic artery. Is it clear? Upper part there may be hepatic artery. यहाँ तक क्लियर है? ओके. तो पोर्टल वेन हमको लगता है बहुत इजी है. फॉर्मेशन समझा? इंफ्राड्यूोडेनल, रेट्रो, सुप्रा, एंटीरियर रिलेशन हमको समझा. पैनक्रियाज, डुओडेनम, लिवर, फिर बाइल डक्ट and then gastroduodenal artery, posteriorly IVC. Here comes the main part, and that main part is, Sachin sir, any guess what is the main part in the portal vein question? Yes, portocaval anastomosis. Hi, portocaval anastomosis. So portocaval anastomosis means portal vein is draining, it is draining the GIT. But some terminal parts of the GIT are also drained by veins, not draining into portal vein but draining into IVC. Draining into IVC. For example, यहाँ पे ड्रेनिंग इनटू द स्प्लिनिक वेन is the inferior mesenteric vein, which is continuation of superior rectal vein, which is draining the anal canal. Now, anal canal is also drained by middle rectal vein and inferior rectal vein, which are ultimately draining into IVC. Left gastric vein is also draining the lower part of esophagus, which is also being drained by hemiazygous vein. Okay. Paraumbilical veins are draining the umbilicus. Which is also drained. Umbilicus, which is also drained by superior epigastric vein, inferior epigastric vein and superior epigastric vein. So प्रॉब्लम क्या है? आप बोलेंगे सर ये सब बता रहे, लेकिन इश्यू क्या है? इशू ये है कि जब लोग दारू पी के लिवर को खराब करते हैं, वन इज दारू, नाउ डेज द अदर थिंग इज फैट. फैटी लिवर हैपन्स when one eats excessive fatty diet, fried food. मैकडी, आप लोग मैकडी को लेके मेरे पीछे पड़ गए, मेरे पानी पूरी के फोटो निकाल के वायरल कर दिया आप लोग ने. बट इन जनरल रोज रोज आप खाने लगे पानी पूरी, तो दैट्स बैड. स्वास्तिक में एक आध दिन, दैट्स वन अनदर थिंग. That fat goes and again damages the liver, causes cirrhosis. Now liver में cirrhosis हो गया. So when there is cirrhosis of liver, this whole blood after this is going to pass through the liver and then to IVC. बराबर है कि नहीं? बट यहाँ पे इतना डैमेज हुआ है, नाउ दैट ब्लड इज नॉट एबल टू रीच द IVC. सो देर इज पोर्टल हाइपरटेंशन. बिफोर कमिंग टू मेडिसिन यू हैड हर्ड ऑफ ओनली वन हाइपरटेंशन, ओनली वन. नाउ यू रियलाइज दैट इज सिस्टमिक, then there is pulmonary, and now today portal. So because of this portal hypertension, what will happen is these veins will dilate at lower end of anal canal, presenting as piles. आप बोले यार ये constipation है, मैदा ज़्यादा खाता है, बोले नहीं. It may be or piles may be due to portal hypertension. Esophageal varices, they may burst and hematemesis. Person may vomit blood. Then paraumbilical veins getting dilated, उसको कैप्यूट मेड्यूस बोलते हैं. ऐसे सडनली अराउंड द अम्बिलिकस, सूर्य को कैसे हम लोग निकालते थे ना, ऐसे ऐसे हम लोग बचपन में निकाला रहेगा ना, तो वैसे अराउंड द अम्बिलिकस यू सी वेन्स, paraumbilical. Okay, there are two more areas, posterior abdominal wall, bare area of the liver, where also there is the portocaval anastomosis. So we are discussing the portal vein. Portal vein is formed behind the neck of the pancreas by union of superior mesenteric vein and splenic vein. After it is formed, it goes above, behind the first part of duodenum. So it has an infraduodenal part, retroduodenal part, and supraduodenal part. When we talk about the relations of the infraduodenal part, anterior relation is pancreas, posterior is IVC for all the three parts. In the retroduodenal part, the second relation is, anterior relation is duodenum. In supraduodenal part, anterior relation is liver. But main important relation which is there anteriorly, if this is, the mic is a portal vein, the two anterior relations will be, one is bile duct, another is artery. In the lower part it is gastroduodenal artery, in the retro and infraduodenal part, in the upper part it is hepatic artery. The tributaries are 5. 3 draining into the trunk of the portal vein, the left gastric vein, right gastric vein, the superior pancreatic or duodenal vein. The cystic vein drains into its right branch, paraumbilical vein drains into its left branch. The next important part is portocaval anastomosis. There are 5 sites. Out of 5, more than 5, 3 main important sites are the superior, the splenic vein is joined by inferior mesenteric vein, which is drained by the, which is a continuation of superior rectal vein, which drains the anal canal, which is also drained by middle and inferior rectal veins, which ultimately drain into IVC. So in case liver is damaged, there is portal hypertension and there are hemorrhoids. Another place is esophagus, which is also drained by left gastric vein, but also drained by hemiazygous vein. So portal hypertension, there will be esophageal varices, there will be anal varices. Third is paraumbilical vein, which drains the umbilicus, which is also drained by superior epigastric vein and inferior epigastric vein. So There will be caput medusae around the umbilicus. There will be veins which are dilated. Apart from these three areas, there are three more areas like posterior abdominal wall, the bare area of liver, where some portocaval anastomosis does take place. Okay. Main applied anatomy of this portal vein is portal hypertension. So in case of cirrhosis of liver, there is portal hypertension, and then these sites of portocaval anastomosis, the lower part of the anal canal, the lower part of the esophagus, the umbilicus, the veins dilate there because, and sometimes they may burst also, causing hematemesis here. It may cause bleeding per annum also. Okay, thank you. Now, the last 5 minutes, I'm going to discuss a very short topic which has a similar relation. See, the liver is like this, and below the liver here, from the posterior side, on posterior surface is gallbladder. Which drains into the hepatic duct, and that forms the common bile duct. Okay? Gallbladder has a small portion below which is called as fundus, then it has body, and it has portion here which is called as neck. So three parts of gallbladder are fundus. Lowermost part is fundus, then is body, then there is neck, then there is cystic duct which drains into hepatic duct to form common bile duct. Common bile duct, the relations will be, it also goes like this, common bile duct, and opens at the sphincter of Oddi along with the pancreatic duct. Right? Common bile duct will also have relations like this, anterior, posterior. Okay? The relations will remain similar. Only posterior relation will be portal vein, because it lies on the portal vein. The anterior relation of portal vein is common bile duct. Okay, so posterior relation of common bile duct will be portal vein, and it will also have same thing like portal vein, infraduodenal part where anterior relation is pancreas, the supraduodenal part where anterior relation is first part of duodenum, and thank you.